Dzień dobry, everyone, and we're welcome, especially to Roche crowd here. Okay. I need to find the way. So why we are here today? Because at Roche, we believe that business should be a force for good. And that is not just our company jargon, that is our heartbeat. And today, I will talk about something different than spreadsheets and cost effectiveness. I will talk about how to unlock the true human value of healthcare innovation, which will shape the future for all of us, that the diagnosis will not be the final stage. But let's be honest, the healthcare discussions are cold, really, really cold. Usually we talk about cost budgets, cutting, and what we don't like, right? But just to be honest, now just imagine you are in a doctor's office and he is sharing with you your diagnosis. At that moment, your life almost stops. You are terrified. You are terrified. There is a lot of fear, a lot of uncertainty. And at that time, you don't think about cost effectiveness. You think about one simple question. Will I get a treatment in time? So the system is thinking about the budget. The patient is hearing a clock which is ticking and ticking. And we usually say innovation saves lives. That's correct. But if we are a bit more precise, innovation gives back time. When we talk about outcomes, we are talking about additional years of healthy life, years where we can have the wedding of our daughter, the wedding of our son, or we finally get the retirement. That is the value innovation is bringing. But there is a huge but. In 2050, every third European, 130 million of us, will be 65 and older. This is a huge problem we have. And then if we go to Poland, fertility rate, the lowest one ever. And if we look, no new children and aging population, seizures are just dividing. So for economy, we need to do things differently. And this medical challenge, it's not just the healthcare ministry challenge. It is a challenge of all of us. It is clear that when we talk about a good economy, a good prosperity, and if we go to Poland, yesterday we have heard Poland wants to be between three most powerful nations in Europe. We need to take this seriously. And let me go 1 second back to this slide. Innovation on the shelves has zero effect. Innovation will bring effect when we finally reach the patient. It is so simple. We are at a crossroads, and we will need to make a societal choice. Do we continue and we manage cost for today? Or do finally we take a decision and we invest in value for the future? I hope majority will see it is the last wake-up call. We move to the right, and we invest in value for the future. One simple example. Take a diagnostic. A simple test today can prevent so many unnecessary things which happen if we are too late. We can also prevent hospitalization, which are not needed if we start treating on time. We are, in current discussions, obsessed with the treatment cost, obsessed with the prices of products. But what we do not see, and it's the highest cost, is the lack of innovation. So we are looking and focusing on the tip of the iceberg. And let me be concrete, using 2 disease areas. Eye diseases, IMD, DMA. 8% is on the top of the iceberg, and that's the public payer. Additional 8% are coming from patients. So 16%, it's on the top. Staggering 84% is below. We are blind for that cost. Nobody is caring about that cost, but the biggest savings are there. Because we do not see how much productivity we are losing when patients are waiting for a long time. We don't see a caregiver burnout, which is happening, and at the end, so many unfinished stories because we are blind and we don't see what is below. The second example is breast cancer. More than 70% is below. And I really, really hope that finally we will take into the consideration direct, but also indirect costs we have. So probably by now you start to wonder what really innovation does. At Roche, we are really looking forward to prevent, stop, and cure diseases. But not someday, but today, now, it is necessary to do it. And this prevent, stop, and cure at the end means for patient, I can be with the ones I love, I can celebrate birthdays, and I can be happy. Value in healthcare is never one-to-one. Value in healthcare multiplies. Take 2 examples. Mother, finally getting healthy. She can go back to her children. She can take care about her children. She can go back and work. Or, even better example, grandparents. If we are able to keep our grandparents healthy, they can take care about grandchildren. They can help their own children. So with one medicine, we are literally helping 3 generations. 3 generations. And that's the value we say it's rippling. But there is a huge, huge but. We have a paradox of waiting. We are paying so-called waiting cost. Waiting. What I have in my mind, you can see 46% of medicines available between 20 and 23. Only 46%. So every second medicine which was registered in Europe never reached the patient. And what is the paradox here? And it's even more. It's $325 billion we waste only in 3 disease areas: breast cancer, multiple sclerosis, and disease areas. Eye disease areas. 325 billion. That's the GDP, close to the GDP of Greece or Portugal. This is what we are paying because we are late and we do not treat. So there is no doubt the current system is broken and we need much more human system. The system which will measure what matters in life most. The system which will measure productivity. And currently, we don't measure this. We need to act earlier, absolutely earlier. When I'm saying this, let's remind ourselves 50% of National Fund is used to put down the fires instead of prevent them. Successful healthcare move already away from hospitals to primary care and to early detection. Healthcare, we should not talk in isolation. Healthcare is a social and economic policy. So how can we unlock the value of innovation? Early intervention, absolutely. We need to do much more with the prevention and screening. We need to have a system which will be ready to change, because change needs to happen. And we need to take decisions on the value medicine or innovation is bringing. That's how we will unlock the system. The proof is in the numbers. 35% life expectancy gain in last decade came from medicine. For the economists in this room, remember, data are clear. You invest $1 and you can get out up to $4. That's the best investment you as individual can do and we as a society can do. And with this investment, we can have less hospitalizations, we can reduce the caregiver burden, and at the end, we will have stability in workforce. So that's what the data is showing. So, at the end, let's change our conversations. Let's change our mindset. And let's not ask anymore, how much does it cost? Let's move to the direction that we will not have ill people. We need to ask ourselves, what is the price of inaction? And can we afford this? Our systems are broken. The value of innovation is measured in human lives. We at Roche, we are feeling this every day, but not just with delivering products to patients, but seeing that mother return to her children, the son return to his work, making the career, and that is the social value we need to unlock together. Dziękuję bardzo.